Good afternoon, everybody, and welcome to our virtual roundtable, which is an intergenerational conversation on consent. And this is a dialogue for Scotland. I'd like to introduce myself. I am Nicola Boydell, and I'm a researcher based at the University of Edinburgh, and I'm one of the Ayres co-chairs. And in the background, we also have helping with the moderation, we have Jimmy Hunter from Terence Higgins Trust, who's a health promotion specialist. So Jimmy will be working in the background to respond and help us respond to any questions. Before we get into the session and I introduce our roundtable guests, I really just wanted to take the opportunity to remind everybody about the terms and conditions that we've all agreed to in terms of participating in this conference. So as has been emphasised throughout the conference, we have a zero tolerance policy for any abuse or attack. And if any comments or questions that are raised are deemed inappropriate, you won't be able to speak or engage any further with the session. The important thing to remember is that we're all here in the spirit of active listening, discussion, respectful debate. And one of the reasons that's so important is that we want to be able to address the challenges that we currently face in sexual health, well-being and social justice in Scotland. So before we get into that, I also just wanted to say that as a panel, we're really mindful that discussion around issues of consent can be sensitive and related to people's lived experience. And it can also be challenging for people who work in the field, professionals that work in the field. So what we wanted to stress is that this is a safe space for us to engage in this discussion, but also for panel members and for you as an audience, if there's any point that you need to drop out, go and have a cup of tea, come back, or indeed not come back, that's absolutely fine, and we understand that. There's an opportunity here for you, as Jimmy's popped in the chat, for you to put in questions and engage with the roundtable guests. But what we're going to try and do is focus our discussion around three orienting questions that we've been thinking about before the session. And so we're going to try and limit our engagement to each of those, to bring the questions and at the end of each of those responses to questions. So if we don't get to everybody's questions, we hope that you'll understand. So after all that bit long introduction, I just want to now introduce our roundtable guests for this afternoon. So we have with us here this afternoon, we have Jordan Ayres, who's the sexual violence prevention worker at Glasgow and Clyde Rape Crisis. We have Alice Walker, who is one of the Rosie Project community. And hopefully at some point this afternoon, if tech issues allow, we're also going to have Carmen Connell, who is a Rosie Project community member too. We have Jess Creaby-Attwood, who is the National Child Protection Director for Sexpression in the UK. We have Oliver Ellis, who is a Health Improvement Coordinator at Essex at Waverley Care. We had hoped to be having, oh, Carmen's here now, so hi Carmen, great to see you. We'd hoped to have Christina McMellon here, who's a researcher from the University of Edinburgh. Sadly, Christina has a migraine this afternoon and isn't going to be able to join us, but has been sending some comments which I will share with you based on the research that they did around consent with young people. We also have Quentin Wallace here, who is a member of the Waverley Care Young People panel. And last but definitely not least, we have Jill Wilson, who is Health Improvement Lead for Sexual Health in NHS Greater Glasgow and Clyde. So without further ado, we have three sets of questions that we want to respond to. And the first question that I'd like to pose for the roundtable is really to think about, what do we know about some of the challenges around communicating around consent for different groups and communities across Scotland? And how does this affect the sexual health and well-being of people across Scotland? I wonder, Jordan, I could come to you first just to get the conversation going.
Awesome, thanks Nicola. Hi everyone, my name is Jordan, and as Nicola said, I'm the sexual violence prevention worker for the Rosie Project, which is the young people's project at the Glasgow and Clyde Rape Crisis Centre. So I guess to start off with your question, there's a lot in that to unpack. So I'm going to be focused, I guess, on a couple of main ones that I come across, I guess, in my work, and maybe more in terms of community across Glasgow on a whole rather than individual communities. But, you know, when we're talking about barriers to communicating sexual consent, obviously we all know that there are lots of taboos around talking about sex. And if we think about consent as like everyone feeling free to choose and being free to enter into what the Scottish government call a free agreement, you know, if we're not able, or if we're in a space where we're not used to communicating about sex, or we have taboos around sex, it can be really hard for us to communicate, I guess, how we feel or our choices. I think, you know, so I don't know if people know about BISH UK, but it's like a sex education resource creator for the UK, created by Justin Hancock, who creates really good resources. And he always talks about this idea of should stories as well, which is this idea of that we like have all these passed down messages of what we should do when it comes to sex. And you'll see these should stories in movies, magazines, TV shows, like you'll hear them from your peers at school. And so much of our should stories, number one, are like, well, we shouldn't be talking about sex. It should be passionate and we should just get into it, and it should. And because we think that that's how sex should look, the focus on that often stops us from maybe slowing down and checking in about what we actually want, checking in with our partner about what they want. If we're talking about, you know, feeling free to be able to choose, we're also needing to talk about people feeling comfortable to say no. And if there are should stories, people might feel like it's not okay to say no or change their mind or want something different because it goes against the should story, because it's not okay to talk about sex, or because of power imbalances. Like if we're in a situation where someone's got more power than us, it's a lot harder to say no. And, you know, we live in a society that's built on power imbalances. So, you know, the basis of white supremacy and patriarchy and all of these things, it's all about these power hierarchies. You know, we're constantly in spaces of power imbalances. And so we need to be able to look at power, I guess, and power imbalances as a real barrier to communicating consent. I wonder if, like, the next part of the question about how that impacts well-being, maybe I can lead on to someone else to kind of add on to that.
Yeah. Well, I can kind of give my thoughts as a young person. I'm Quentin Wallace, member of the Waverley Care Young People's Panel. And I definitely, you know, agree with the idea of should stories and kind of societal sexual scripts, where I think that can, again, certainly among young people in Scotland that I've encountered, there tends to be a kind of, you know, a sense of pressure to automatically know all of those things and to be just the best at sex. And the pressure to be the best at sex is pretty stressful, because nobody's the best at sex. Nobody is so good at sex that they don't have to talk about it and that they aren't going to come up against barriers. So yeah, I don't know, that can be something that causes a lot of stress for specifically young people. I'm assuming everyone. But yeah, no, just the general kind of the general sense that if you don't automatically know things, so say you don't automatically know whether the other person is having a good time, or you don't constantly present that you're having the best time, because that would be, you know, impolite if you weren't having the, you know, it can kind of feel like if you're not having a good time, then you're doing something wrong, you know. And so yeah, that can, I don't know, I keep saying the word pressure, but like it can be a lot of pressure, and it can be it can be just very stressful. So obviously, big negative impact. I don't know if somebody else can take away from me before I keep rambling.
Which adds, it sounds like what you're saying is that adds another dimension to the challenges around articulating and communicating around consent. Oliver, I think before you were going to come in, was that right? Were you going to add something?
Yeah, to add to both what Quentin and what Jordan were saying actually about should stories and about that pressure people feel around sex. I think it's important to look at the pressures that people of different identities feel. So my work with SX, we generally focus on gay, bisexual, and all men who have sex with men. And so looking at the pressure that like queer men in particular face, there's, I guess, sort of a stereotype around queer men being almost like hypersexual because sexual liberation is an important part of our history. But on a day-to-day basis, that isn't necessarily something that is part of everyone's life. So I think in particular, we work with a lot of people who are maybe, fresh onto the queer scene. Maybe they've just come out. Maybe they're sort of getting attention from men from the first time. And that can be really validating, but it can also, bring in some confusing feelings around whether all attention is good attention, because I think sometimes you can kind of convince yourself to feel that way when in reality it might be something that you're not comfortable with. So I think one of the issues is that we're, going up against these like stereotypes and these subconscious beliefs that people don't even really know are, influencing them to feel that pressure. So I think, those sort of should stories and stuff just are really harmful to people, especially looking at like different identities and how they influence, each other and how we actually, sorry, I've kind of lost my point here, but how they influence us in like our actual like everyday life.
Yeah, I can kind of jump in again with a slight addition to that, where it's definitely like the way that people with certain identities, again, obviously, I know I've sex with men, an example of those. There can be a sense that people of a certain identity owe other people themselves as either a fetish object or an example of that community. And so, I think that can be damaging for the person from that community and also for wider society. Don't know if I articulated it.
It's really interesting because I think that came through in one of the earlier sessions today around gay men's intimacies and this idea of fetishization and the kind of really negative impacts of that and how that relates, I think, to these sexual scripts and should stories that we've been talking about. Jordan, I think you've got your mic off. Did you want to come back in?
Yeah, just to kind of like, I guess, add on to, the same kind of conversation and how this really affects like sexual health and well-being as well. It's like, so consent is all about everybody feeling free to choose. And as like Quentin and Oliver said, should stories make us feel pressured? So if someone else is putting pressure on us, or if we're putting pressure on ourselves, we get further and further away from like a really nice consensual situation. And Quentin, when he was talking about, this idea of being good at sex, I think, or performing well at sex, that really speaks to this idea of people in a way almost like disengaging from the moment and kind of dissociating from their body to be like, you must do this to be good at this. And so, under this idea that you can be good at sex, there is no good at sex. Everybody's body is different. Everybody's bodies need different things. And the only way we know about how to engage with different bodies is by asking and checking in and, and paying attention and going slow and all these types of things. So if you're thinking about like the impacts of sexual health, if we're in a space where we're constantly feeling pressure either from ourselves or somebody else, where kind of separating and away from our body and what our body wants and checking in with our body, I guess we're getting further away from having a really intimate or nice relationship with ourselves and our body and our sexuality and what we need. And I think, if you're thinking about, I'm just thinking about like women's health, and the fact that like a lot of the time when it comes to like, so anyone who's got like a uterus, and if we're talking about how there's a lot of stigma around like going into getting, I don't know, checkups around those types of things, and sometimes people will have how to explain it, like trouble articulating or finding pain in their body or having that pain validated or whatever. Like I think that's really connected to us being like disembodied in a way. Like I think there's a real connection there, and I think then that kind of knock on to sexual health and mental health and physical health is, yeah, I think there's a lot in there.
Jess, I can see you're going to come in.
Yeah, thank you. So I think something that I've been looking a lot into kind of with my work with Sexpression, we're constantly trying to keep up to date with the things that we're teaching young people, is this movement away from the enthusiastic model of consent to the authentic model of consent. I can see some nods, which is really great. And I think, just talking about the different expectations of why people have sex, particularly in relation to these should stories, we need to be considering why we want to have sex, what pleasure we're getting from this, but also how different people communicate, because enthusiasm is often read in a very kind of neurotypical Eurocentric way. And we need to be able to have conversation, however that looks in any particular relationship, about how pleasure and even just why we're having sex, why that is taking place. Because this idea of showing enthusiasm and how that is shown, in TV and film is very different to how a lot of people do actually experience enthusiasm, and whether that portrayal of enthusiasm is present in sex. So I just thought that, that is a big communication barrier that we have in the way that people have sex, because that isn't often talked about. Yeah, I think that was just brought to my mind.
Yeah, I'm glad somebody else said it instead of me, so that I will not rambling on. But yeah, like the concept of enthusiastic consent, and I think, actually I'll take it to a kind of wider point of a barrier to talking about consent is what the model of consent is that you're talking about. Different people are going to be working from different models of consent. What the generalized societal model of consent is seen as is going to be affecting, how you're behaving. And the model of enthusiastic consent being the kind of the best one, the best, I don't know if you can see my hands. Anyway, is just another should story. Like, it's just another pressure to live up to. Am I presenting enthusiasm enough? Am I presenting enthusiasm in the right way? And it can be quite exclusionary, while of course the concept of enthusiasm is something that, for example, I'm on board for. I think, if everybody is internally enthusiastic in the sense of having a good time, that's a good thing. But the kind of emphasis on exactly how you should be enthusiastic isn't going to work for everyone. It's exclusionary of people practicing certain kinds of BDSM. It's exclusionary of certain asexual people and how they might want to be, having sex. Obviously, it's exclusionary of a great deal of neurodiverse people who are not going to be communicating using the same kind of specific kind of expression. Yeah, it's quite the thing. And again, I'd take that, kind of wider than just enthusiastic consent bad, and into more like, whatever model of consent is being used is going to inform how people think that they ought to be behaving, and how they're going to want to be talking about it, or how much they're going to want to be talking about it. Okay, no, I'll stop.
I was just going to say, I can see that Jill's got the microphone on, and I wondered if you wanted to join the conversation around those kind of different models of consent and the link to well-being.
Yeah, no, I just wanted to kind of just what Quentin and others were saying about the model of enthusiastic consent. It was just really interesting, and it was just making me I just wanted to add a wee bit onto that. That was all, because and I could come back to this later in the conversation, but it's something that myself and my colleagues and 2 of the other health boards have been quite a learning process for us. You know, we've been trying to respond to, I suppose, poor situations for young people around consent and looking at what we can do. And Quentin, I know we've scooped you up into that project now as well. But just off the back of what you were saying there about these kind of models of consent and enthusiastic consent and the limitations, and there's something I was reading recently that was talking about how with anything like that, it's there's an expectation that people come to a sexual situation with a clear idea of what they want or what they do and don't want, but in actuality a lot of people don't necessarily know what they want, or they know what they've liked previously, but you know that it's a sort of physical conversation, intimate conversation with the other person, so maybe what they've wanted previously and with other partners isn't the same. So there's this other sort of layer of just the lived experience of it, that these kind of set models don't really provide you with the structure for, it's, yeah, so that was all.
Thanks for that, Jill. So there's lots coming through here, I think, as we think about what some of those barriers are. We've been talking there about bodies, embodiment. We've been talking about how that links then to experiences in other contexts and the kind of corollary for sexual health. We've been talking about scripts and should stories and the importance of that. So that's lots on there. I kind of wanted to also have the opportunity to share kind of some of the messages that I'm getting through from Christina and Catherine, who are not able to join us today. And they've taken it in a Catherine's taken it in a slightly different direction and said, so one of the things that they found from the work that they've done is that private schools sometimes and religious schools and parents have control of consent education and don't necessarily put the safety of pupils above their own agenda. And that's something that they've really struggled with in the work that they have done around sex ed, and have experienced themselves as experienced similar experiences. I just wondered if that spoke to anyone, or anyone wanted to kind of come in there around that.
Yeah, I agree. Certainly would say that is a common issue. It kind of reminded me specifically, I don't know if somebody else can say something more relevant to the faith schools thing, but it reminded me of the fact that so I do a lot of work with LGBT people, and a lot of from what I've kind of heard of LGBT people's experiences surrounding sex education in school was that a lot of, not only was there not very inclusive education, but oftentimes schools were operating from the perspective that Section 28 was still in place, and had kind of forgotten that it wasn't. So it's kind of like there are barriers that schools think exist or are created by schools that are preventing education. But yes, if somebody else could say something specifically on the
I can see Jordan's nodding and also has a mic on. So Jordan, did you want to come in there?
Yeah, I think I don't think that comment about faith-based schools having that extra barrier probably surprises many people. I guess in terms of like a hopeful message is, so like a big part of my job is to go around and talk about consent and things like that at different schools. And I have been getting more and more Catholic schools in particular, and schools with like high numbers of like Muslim pupils as well, that are wanting that space more, wanting more sex ed, and seeking out people that they think are going to be able to have the conversations more, because I think a lot of the time the school itself feels like we're maybe not placed best to have those conversations. But I do think that one of the kind of, I guess, another barrier I think that kind of comes up around this stuff is like, whilst it's really good to be able to like go in and, you know, try and have inclusive workshops or participatory workshops in faith-based schools around consent, the more I kind of do this work, the more I realize that it needs to be like, consent should be modeled more in school, and how the teachers engage with the pupils, how we watch pupils engage with one another. It's a conversation that really, like all of the stuff that the speakers have been talking about, we're talking about really nuanced stuff, like conversations that involve like proper, deep, critical kind of unpacking and reflection with young people, conversations that in my experience young people are so ready for, and they so have the language to do it. And I think, you know, one of the issues with the idea of sex ed is that it's this idea of like get a one and done, we'll go in, we'll talk about consent and we'll talk about sex. And I think that Scotland in particular is doing really well in trying to, you know, have more inclusive pleasure, or like realistic pleasure focused kind of sex education, but like where we live in a world that's just all about peer pressure and power imbalances. And so if we want to be able to connect with consent, it needs to be a conversation that we're having all the time in every part of school. And there's so many schools like faith-based schools or private schools or just school in general that feel completely out of their depth to be continuing those conversations. And so that's like, yeah, I mean, yeah, I don't know how to think of that.
I can see that both Carmen and Oliver would like to come in. Carmen, you've not had an opportunity to speak yet. Would you just like to say a little bit about touching on this?
Yeah, of course. I went to a Catholic school. Me and Alice went to the same Catholic school. We didn't have a sex education at all. The best sex education we got was in human biology, because they covered contraception. But before that, we had to get a disclosure about how that didn't go aside with the school's teaching and things like that. But if you didn't take human biology, you wouldn't have got sort of that teaching on contraception or anything like that. And I know that the school that I went to is kind of trying to block the workshops from Rosie as well. They've not wanted them to come in. But I think an important point is that all these things and how they teach consent and things like that was between a married man and woman and all that, and it's quite backdated. But all these things also add to victim blaming attitudes. So if you're going to a school, you don't get taught these things. Something might happen, you're assaulted, you know, you're taught, oh, well, I didn't say no. It's not as simple as that. And that just adds, you know, to how complex it is and how difficult it is to deal with these things. And, you know, a lot of people that have been assaulted, it might affect, you know, their sex life. And just because you've been assaulted doesn't mean you can't have a good sex life. I mean, that's a load of crap. So it totally disconnects, you know, all these things. You mean, you should be able to enjoy sex after it. And that's sort of a bigger issue that comes with all these things as well.
Yeah. Jess, you wanted to come in there and respond to Carmen.
Yeah, I'll come in quickly. I know we've been talking about this for a little while, but I think just that idea of, you know, I haven't said no, it often comes from as well either the adults who are delivering this information, whether they're teachers, whether they're parents, whatever kind of adult figure in their life, either haven't been taught consent themselves or have been taught a very outdated model. Usually, I mean, people who are at university, you know, they have been carried on with this message of no means no, or maybe yes means yes. It's very rare that then the education is including kind of the authentic model of consent or any other kind of more recent models of consent, because the adults who are delivering this information aren't trained. So they're going on what they were taught as young people. And so, you know, teachers or parents, their education of consent often isn't continued. And so an outdated model often gets kind of continued as well with that.
Yeah, some really important points. I'm mindful of time, as you said, Jess. We've got some it's great that we're having this conversation. We've got some other points to respond to, but Oliver, before we kind of move on, did you just want to come in there?
Yeah, I can come in just real quick, just to kind of go off what folks have been saying. Because in terms of consent education, I think talking about the disparities between different types of schools is really important. Because I have some experience with sex expression as well. I was part of the Edinburgh branch for a few years, and you know, our concern was that, you know, we're going into some of these schools and having really, really, you know, nuanced conversations around sex and consent, and like, you know, even what we were talking about earlier about like, you know, people being neurodivergent and like nonverbal cues. Like I've had that conversation in schools with students, and it's great to know that people have these questions and are capable, like Jordan said, of talking about the stuff. But then the concern is like, there are folks that we aren't reaching who are maybe in more vulnerable positions because they're not even really learning about sex at all. And so I guess for me, the question is always like, how to get away from like, not get away from, because we should still be in all the same schools, but how to expand our reach, I guess, to schools who aren't, you know, it was mostly sort of like private independent schools that we were going into because those are the ones who wanted us there. But, you know, reaching into different schools who maybe don't have those resources already, I think is definitely something that we need to work on going forward.
Yeah, that's a really important point. And you know, you've really beautifully just helped us kind of segue into the next question, because it's thinking there about what kind of work is being done and good examples. So if I can kind of pose to all of you who are here, what are some examples of good work? We've touched on some examples Jordan drew on earlier, and you've been talking about sessions, but what are examples of work that you know that's currently being done to address these barriers to communicating around consent? And I suppose also importantly, how might learning from this type of work be used to inform developments in other areas? And yeah, what do you think? Can I open that up to you?
If it's okay, I'll start off with a little bit about what Sex Expression are doing, if that's all right. So I think the thing that we really want to focus on as breaking down barriers is the fact that we are a near-peer organisation, and this really helps a lot of times. The volunteers who are going into schools and youth groups, we understand what the young people we're teaching are going through. That's not at all to say that once you pass a near peer age, that's impossible. It's just the way that our charity works, and it is a way that we think breaks down some of these barriers. I think then also, because we kind of have two different areas of what we do, we go into schools and youth groups, but now we're also doing a lot of workshops in universities. Our branches are formed in universities. And so a lot of our branches are now delivering kind of workshops of kind of RSHE at a university level for the universities that we're in. A lot of this is about consent, because as we talked about, a lot of people don't get very good education in school. They'll then come to university, an environment where, you know, there are a lot of opportunities to have sex. There is a lot of social pressure to have sex. And they haven't had the education beforehand. So kind of getting that intervention and that education saying, you know, first of all, this is what consent is and this is what consent looks like. Also, don't feel pressured to do anything. All of these different things at the different stages, all the way from kind of very early on in secondary school up to university, I think is very helpful, along with us being a similar age to them. I think that really helps with those communication barriers.
Yeah, so for you, I mean, I think you've touched on it, but what do you see as the sort of the key, why it's so important to have that near peer age focus? Yeah, so one thing is I do think it helps the communication with the young people. I think they are sometimes able to relate to us more, and so they are able to kind of have that free conversation. They don't see us as the teachers who they see every day at school, but also we're able to relate more to them. we went through school not very long ago, and so it's that similarity in age that I think really helps that conversation flow, I guess. Yeah. Jill, thanks for that. Jill, were you going to come in there?
Yeah, not directly in response to Jess's, if that's okay. It was just, I guess, just another kind of explanation of work that's going on. So my team within the health board, we work from like early years right through to early adulthood, and we work with 6 local authorities within our health board area, and for the past few years we have been implementing a programme called Early Protective Messages, and that is about age and stage appropriate learning about consent from nursery onwards right through. So the kind of, without getting into too much detail about it, because everybody here understands what that means. But really this is about, at that stage, I guess the approach is really about, it picks up on some of what other people were saying about other people in young people's lives being able to talk about this and being able to talk about this in a helpful way. So this is really about skilling up, or not even skilling up, so the adults that are the scaffolding around the children at each age and stage, helping them feel comfortable to weave this in to their day-to-day care, or their day-to-day teaching, or their day-to-day youth working, or whatever it is, so that it's just part and parcel. So obviously at that younger end, it was partly driven by child protection for that younger end, and because they do need that at that stage in terms of the amount of personal care that's involved, but it's also about laying good foundations for later on in life, with the recognition that, and I think we've all talked about this in some way or another, as it's quite hard to learn that when you're suddenly like a teenager, isn't it, if you've not had the building blocks for that. So at that very early stage, how consent plays out is obviously in like a non-sexual way. It's to do with like having agency over their own body, and it really makes sense at that early stage to start that, as I was saying, because of the personal care that's involved. So it's modelling that, so that then children come to expect that from, at that stage, the adults in their lives, but also from each other in play situations and things like that. So that is, we're really surprised and pleased at the extent to which people in the local authorities have got on board with that. You know, we just pleasantly surprised with that. And then the idea obviously is, in terms of environments that our children are in, that then continues through into primary, where we're more then getting into the territory of taught lessons, but it's also the school environment, and there's an expectation around that kind of agency, children's agency, is honoured within that, out with lessons as well as within specific lessons. So you know, we do have some impact data in terms of the early years setting, but in terms of how that continues on, we need to track that and see if it's doing what it's supposed to be doing. So, yeah.
I think it's really interesting, and I think what I hear from that is that links back to some of the things that Jordan was talking about earlier. I think about thinking about consent as a much wider, more complex and nuanced issues around agency, and the importance of modelling this in all aspects of society. We're talking here quite specifically in many ways about sexual consent and communicating around that, but consent as a much wider issue. Anyone else have examples of good work that you think is being done to address barriers to communicating around consent that you're aware of? Jordan, were you going to come in there?
So I don't know, if you ever spoken to me before, you'll know that I'm absolutely obsessed with BESH UK, which is created so it's an online platform for young people that is all about sex ed, written for young people. There's also resources on there for parents and teachers to be able to do interactive things with young people. One of the things that I really like about Justin Hancock, who creates that, is that his model is rather than sex positive, I guess, is more sex critical. This idea of a lot of, there's so many good things about the sex positivity movement, but it can, I think, like Quentin might have mentioned before, create a whole new should story. And this idea that, sex should be something that you engage in if you want to, and it should be you know, consensual, but we might not have the language, or we might not know exactly what we want, exactly like what Jess was touching on. And I think, like, I can't recommend them enough, particularly like because they have, well, Justin's created such a good platform of resources. He's released a book as well, which is Let's Have a Conversation About Consent or something like that I can really recommend as well. But they're always doing podcasts for adults. And one thing that I think when I'm talking about work that needs to happen, do you know, so often when I go into schools, I'll come out of a workshop and be like, these young people are amazing. Like, they will already be talking about like power and intersectionality and all this kind of stuff. I'm like, this is amazing. And then I'll go to the pub and be like, this is horrific. And I think one of the big things in terms of spaces that are really missing is adult education, and bringing these like nuanced conversations, these critical conversations into people that are older than 25. Which, you know, I don't know, maybe we could start doing like consent chats at the pub or something. But that is where I think there's still a lot of work to kind of go from, I think.
Yeah, like I would agree. I think that you know, there are certainly specific adult spaces where a lot of conversations, very interesting conversations about consent are being had, but those are, you know, not, those are specific spaces, you know, those are maybe spaces associated with vice industries, or like spaces that are associated with specific subcultures, and they're not, or people, you know, working in the field of sexual health, they're not ordinary conversations that everybody is having. Which, yeah, no, that's a huge thing. I'm so glad you said podcasts as well, because I would definitely recommend the, like, Justin Hancock and Mike John Barker's podcast. Yeah.
I was just thinking it would be great if somebody was willing to pop in the chat a link to some of these things, so that people who are in the audience maybe have the opportunity. I mean, I know we can all go away and search for it, but it'd be fantastic if you could put that in.
Yeah. Another kind of resource that I really like are there's like the quick and easy guide sort of little graphic novels. So there's things like a quick and easy guide to they them pronouns and queer and trans identities. And there's one about consent, which it's not perfect, because it does kind of end with enthusiastic consent and say this is kind of the best one we have right now, kind of thing. But I do like to give the quick and easy guide to consent to people. It's like a little graphic novel. It's like £8. Yeah. Yes.
So good work out there. Sorry, I interrupted you.
Yes, no, I was going to, again, maybe bring that to a wider point about resources that exist. That's good. And then in the future, more of those kinds of resources, I think, can get people talking, because, again, there are places where there are workshops and there are, you know, conversations, you know, just places to have these kind of discussions, like here right now, you know, where those discussions are taking place. But I think a lot of the time, if you can link someone to a website, or you can give someone a book, or you can say, oh, hey, listen to this podcast, like, it's getting the conversation about consent out of their own spaces and into the people's spaces, you know, and into their lives. So, you know, because you can have your resource on your phone, whereas you can't have like a roundtable discussion on your phone at all times. Yeah. While I still have my mic on, I also wanted to talk about briefly the NHS resource with the consent with the short films that that's also happening. Maybe Jillian would be better equipped to talk about that.
Thank you, Quentin. That was a nice segue. I can see there's other people wanting to come in though, so I'll be brief. Yeah, we did. There's enough of us in this group that we really do need to give a little trailer for Quentin was talking about. We talked about resources that exist, and a few of us in here are involved in creating another resource that we hope will be helpful, and that is really about providing something that just shows what it looks like when it's going well. You know, so it's not going to fix everything to do with the macro problems that we've talked about in terms of power imbalances, and it's not going to sort all that at all, but we hope it will be like a useful contribution to the sort of suite of resources that we feel there's a gap there about just that really. What does it look like when it's going well, taking into account everything that we've talked about here? And so the health board I work for, and actually it started off with ourselves, Lothian and Lanarkshire, but now I would say there's probably 3/4 of the health boards in Scotland on board, so we will be putting it out as a national bit of work, and we're very lucky to be getting guided through it by some of the people here and some other really, really helpful groups of young people and their youth workers. So watch this space.
Thanks, Jill. Oliver, you've been really patiently. I've seen your mic's been on for a wee while. Did you? And Alice too. But Oliver, did you want to come in?
Yeah, I can come in real quick. Just in terms of resources, Essex has a lot of resources around consent. And in particular, there's one called Between the Covers, which is like a magazine that was made, by service users for the community. And I think it's good to kind of get a different kind of resource out there, one that is a bit more creative. I think the sort of straightforward resources and websites and stuff are really good, but other people might respond a bit better to something that's more like a comic or, like a narrative, some kind of story. And I can actually pop the link to that in the chat as well. But I wanted to go back to Jordan's point about like consent chats in clubs, because one, I think that's great, but also like that is kind of something that we do try to do. So we deliver like little sort of sexual health packs to local bars and clubs. And in that we have like condoms and lube, but also resources about consent and how, drugs interact and like all these different things that the people that are getting these packs might not really come to us for these resources. So it's important for us to kind of go out there and actually do the outreach and go to them, even like putting condoms at like local cruising sites and things like that, reaching these communities who aren't necessarily going to ask us for resources. So it's important that we actually go out there and like give them to them.
Oliver. Alice, did you want to come in?
Yeah, just to talk about resources. Prior to COVID, the Rosie Project community made zines. So they're resources for survivors by survivors, because we felt there was a gap in that area. But what I also like to talk about is we do a lot of consultation work. So we are working with the NHS on their consent resource. We've worked with the government. And I think that's the key point, is these organisations are asking out, and they're asking not the right people, but the people that know what is needed. And again, as Carmen said, we went to Catholic school. We didn't have an education on consent. Apologies, this is Italian work. We didn't have. We know what's missing, and we have the knowledge to show you what's needed.
I think what's really coming through from this and from this conversation is, for me, is lots around the multiplicity of different approaches and the different resources that are out there. But from your comment, Alice, and also from what Oliver and Quentin have been saying, it's also about really what the spirit of this conference is about collaboration and about drawing on the experiences and bringing people together to work collaboratively to really improve sexual health, and in this particular case, think about consent. But I'm also conscious that Jordan, you're waiting patiently too to come in.
So just really quickly, I guess, two like separate points. I realized that I didn't actually mention, so like my the program that I work for, so I offer I guess sexual violence prevention programs or top like workshops in schools across Glasgow, but that's actually a national program. So you can get in touch with your local prevention, like sexual violence prevention worker at all of your rape crisis centres across Scotland, which I probably should have mentioned. But I think as well, like in terms of thinking about like the future stuff, these conversations that we're having, these really hard conversations that are trying to, battle things like, you know, racism, sexism, homophobia, transphobia. All of that is also really important for consent, because like if consent is about having the freedom to choose and having your choices respected, but we have members of our society who do not have the same space to choose or the same freedoms to choose, then we're not going to be, I guess, in our most consensual kind of cultural space. So like, yeah, what Alice was saying about, you know, organizations needing to reach out to like the right people and collaborating, it is so important, because like, you know, in talking about consent with young people, you know, I bring my own perspective, but there's so many perspectives that I will be missing that need, you know, voices that need amplifying, that we need to take that intersectional lens and work out how to reduce power imbalances, because they're so like, it's so vital that we really kind of unpack that if we want a consensual conversation, or where consent is like something that we live and breathe. So yeah, I'm just like, I feel like I'm just being like, yes, exactly what Alice said, like exactly what you're saying. Collaboration is so, so important to make sure that, and like all of us said, we're not missing people, because when people are missed, then, you know, we're forgetting about people who should have the freedom to choose, but maybe don't. So yeah, that's all.
Yeah, thanks for that, Jordan. I think that's so important, and really thinking about why we're having all of the roundtables that we are across the conference, and highlighting these issues and the way that they all intersect, as you say. I mean, it's not just about taking an intersectional approach, but thinking about the multiple layers and complexities around that. I'm conscious of time, and I hate to move us on when we're having such rich discussion, but I think again that goes beautifully into the third area that we'd thought about discussing, which was what areas of work, future work, need to be prioritised across Scotland. And really, in the spirit of today, how might the types of intergenerational conversations that we're trying to facilitate around consent help advance the types of work that we want to see taken forward in Scotland? Would anybody like to kind of start us off on that?
Well, drawing on what the chat is saying, I think is interesting. People are talking about slightly older people getting refreshers, you know, updated information, and I think that's a way in which intergenerational conversations are important. You know, if younger people who are maybe aware of more sort of different things can you know, educate older people to learn how to function in a changing society. That's important.
Jess,
yeah, I think one thing, it isn't too focused on the intergenerational approach, but one thing that I do think is very important is making sure that people who work, particularly in education, but in any kind of environment where disclosures could take place, that wellbeing support and training is put in place. Because I know, you know, if you've signed up to be a maths teacher, you probably haven't thought, you know, I'm taking on the responsibility for a young person to come and disclose something very serious and very potentially traumatizing. So making sure that, first of all, they're trained for their own well-being as teachers, but also making sure that they're trained to know how to respond in order to not re-traumatize the young person who is making the disclosure. I think that, you know, that's an area that, as far as I know, is quite missed. It's not overly focused on. I could have missed something, but you know, I have experience teaching outside of the world of sex expression, and you do get told stuff. And I think in every education environment, that training should be provided.
Carmen, were you going to come in there?
I'd like to add to that by saying also youth workers and other sort of organizations, not just kind of teachers, but people who are going to be working with young people, I would say also need that kind of training.
Absolutely. Carmen, were you?
Yeah, I'm just going to add to that. The NHS as well. I've been an NHS worker for 5 years. That's my part-time job. I take bloods in all the wards, and even though I'm maybe a slightly lower band in the NHS food chain, you know, I do still need to have difficult conversations with patients. Not necessarily just assault, could be anything, but we don't get training for that. There's also the other side of the coin, is we obviously get prisoners as well. We might get perpetrators, and that's also something that's quite distressing. And we don't have conversations about that. And there's also situations as well where, you know, if something does happen, there's no training for us to deal with it, but there's also no support if something does happen, if somebody does have that conversation and it is distressing, whether you've experienced it yourself and that's maybe triggering, or it could be anything really. There's no support for that either. So that needs to be something that needs to come into place to support staff, especially. And, you know, I think this time with the pandemic, I think it's really shown that particularly as well, because there's already extra stress on. So this lack of support and lack of training kind of really doesn't help sort of the situation or staff morale sort of as well.
Yeah, absolutely. And I think that, I mean, often in my experience and in research experience, the issue of training and support comes up repeatedly across all different areas. And it sounds like that's a really important dimension to be exploring and to be thinking about, as you say, managing disclosures and kind of the effect then for other people when they require support. Jordan, are you going to come in here?
Just to say that, you know, at Glasgow Clyde Rape Crisis, we do offer like teacher training. It obviously is dependent on if the school would like to have teachers trained, and usually it's then only ever like the PSC or pastoral care teachers that are like really into it. Like Jess was saying, that, you know, not any like random maths teacher is going to get that. So yeah, but Rape Crisis Scotland are releasing a new program called the Equally Safe at Schools program, which is all about like a whole schools approach to kind of dealing with gender-based violence. And a part of that is trying to bring all of the school into that conversation. So I guess if you know, there are teachers or members of you know, education facilities that I guess are watching this now, like that could be a good place if you want to start to get into that. Yeah, that's just a plug, really.
And there was an awesome session on that this morning with introducing the whole of the Equally Safe program. So again, I think there's opportunities to be able to go back and re-watch sessions if you haven't already. So please do that and have a look at some of the things that Jordan and others have shared. I'm conscious that we haven't brought in lots of the really good conversations that have been happening in the chats and the question and answers, but it's been such a rich discussion, I think, and I think we really could have spoken for much longer, 2-3 hours here, and brought in so much more. But I would like to take the opportunity as we come to the end to thank everybody for their time this afternoon and for their engagement around this, the conversations that we're having around consent, and seeing this really in, again, with the conference being what it is, as a collaborative space, as a space for different communities to come together, and is to think about how this might be a springboard for further work and for further collaboration as we move forward in Scotland. So if I can just say thanks to everyone, to Carmen, to Quentin, to Jess, Alice, Jill, Oliver and Jordan, thank you so much for your time this afternoon. And we hope that everyone that's in the audience has had lots of food for thought. Thank you so much. I should say as well, failed to miserably to add this on, that there's a poll at the end of the session, which has been, as you know, at the end of all the sessions. So we'll wait here till that closes, and please do fill that in. That would be wonderful. Thank you.